Hello, this is Dr. Rebecca Bernard, and thank you for joining me for a discussion of physician wellness in the era of COVID-19. Please feel free to reach out to me at any time via my website or my personal contact information if you have any questions or need any additional information. And please check out my book, Physician Wellness, The Rockstar Doctor's Guide, that was co-written with psychologist Stephen Cohen. We've known for some time that we need to talk about physician wellness because studies have shown, especially in recent years, that doctors are reporting high levels of burnout and general unhappiness. We're seeing increased rates of depression, especially in medical residents and students. And most disturbingly, about 400 doctors per year are estimated to take their own lives. Almost 50% of all physicians report making active plans to leave the practice of medicine because of the amount of burnout that they're facing. Doctors report that they are trying to take early retirement, change to administrative jobs, or consider cutting back on clinical hours by switching to practice models like concierge medicine. If you look at the data on who is happy, you see from this data that was released in 2016 that most doctors report pretty low levels of happiness, especially at work. The green line shows who's happy at work, and the dark blue line is who's happy outside of work or at home. The happiest doctors, according to this study, were dermatologists, and I always like to say if the dermatologists are unhappy, you know we have a problem. Only 39% of dermatologists reported feeling happy at work and 66% outside of work. The most miserable doctors in this study were the internal medicine physicians, who were only 24% happy at work and 53% happy outside of work. A Medscape study 2 years later reported that 42% of doctors were burned out and 15% of all physicians reported feeling depression. Some of the important causes of burnout include the amount of bureaucratic and administrative tasks that physicians face, the number of hours we spend at work, feeling like we're not able to really make a difference or provide patients with the quality of care that they need, financial pressures. And of course, we know with COVID-19, a lot of these factors are only increasing. In fact, a study of Chinese healthcare workers in the beginning of the pandemic, when it was first impacting China, showed that 50% of all healthcare workers experienced symptoms of depression. A third reported insomnia, 45% anxiety, and the vast majority of healthcare workers reported significant stress involved with caring for patients during this pandemic. Data from the United States that was released in May showed that COVID-19 increased burnout in 55% of respondents. Some of the most severely impacted physicians are those that are working on the front line, directly dealing with patients, and especially in hotspot areas like New York City, many physicians reported being simply overwhelmed by the amount of patient death and disability that they were dealing with. Doctors reported a sense of futility in seeing their patients die so quickly and not being able to make a real impact on them, and also the stress of making difficult decisions and the ethical dilemmas that come from deciding what patients get a ventilator or who goes into the intensive care when resources are limited. And of course, there's just the sheer exhaustion as physicians were dealing with a high volume of patients, but not just in the front line, also those in offices that are being inundated by phone calls and messages from anxious patients that are looking for advice and reassurance. For these frontline physicians that are coping with severely ill patients, we know that a lot of the care that they're providing can lead to some of the risk factors for depression. We know that dealing with death is definitely a risk factor that can lead to physician depression, as can the stress of 24-hour responsibility and lack of sleep that comes with taking these long shifts that some doctors are doing. Of course, if a physician makes a mistake or feels that they didn't do enough, they may become vulnerable to self-criticism, which is definitely a risk factor for depression. A physician that did take her own life in New York City made some remarks to others that sort of indicated that some of that sense of futility and the feeling that she wasn't able to do enough may have led to her decision to take her own life. Another risk factor for depression is difficulties having relationships with your coworkers and your patients, which can be challenging, especially if you're dealing with new coworkers because your usual coworkers are out on leave because maybe they're ill themselves. and of course the stress of dealing with anxious patients. So we need to keep in mind that especially those of us who are on the front line, if we are engaging in any of these risk factors, we need to be especially cautious and proactive about dealing with them. Some advice from the World Health Organization for mitigating these risk factors include making sure that your work schedule is flexible and that you have enough breaks. Really, 24-hour responsibility really should be a thing of the past, because we know it's just not associated with good outcomes for patient care and for physician wellness. The World Health Organization recommends that teams communicate and that they rotate so that they're not always in the highest stress areas of the hospital or their facility. And what's really important is that hospitals and organizations make sure that doctors have the opportunity to have peer support and professional mental health support whenever necessary. Doctors need to be encouraged to take care of themselves, and it's really important that we learn to acknowledge the emotions that treating these patients can bring out in us, and also practicing self-compassion and realizing that we can't do it all, and that sometimes mistakes could be made, or there could have been something more that you felt you could have done, but realizing that it's just not possible to be perfect all of the time. If you're starting to feel the stress of dealing with these patients and all the implications of COVID, then we need to have a very low threshold for reaching out for professional support. And one thing that's really important is to avoid isolation from family and friends. And that's been extremely challenging because of quarantining and keeping ourselves away from others to prevent spreading COVID-19. I know many physicians, especially on the front line, who have made special arrangements to actually isolate themselves from their family to protect their family from potential exposure. Some have been staying in their basement of their home or in hotels, but actually isolating yourself from your family especially can be really hazardous to your mental health. So it's really important that we continue to nurture those relationships that we have. Physicians report that their number one concern about COVID-19 is keeping their family safe. Doctors are extremely worried about their spouse or their children or extended family members getting sick because they brought something home. And that's certainly very understandable. So the first thing that is important is that doctors need to insist that proper safety measures are being taken if they're going to work in a facility. They need to make sure that they are supplied with the proper protective equipment, and really should not practice and not treat patients if that is not being provided, because that is the way that we're at higher risk for getting ill and bringing home the virus to others. Once you've insisted on that, then you want to create and follow office protocols for yourself to make sure that you're practicing medicine in the safest way for yourself, and avoid being complacent, because as we start to get more used to treating patients with COVID, it may become easier to become lax in taking those precautions. If you're still anxious, even though you're following all of those guidelines, then you may need to practice some cognitive behavioral therapy in really helping yourself to think about things a little bit differently. So first of all, we have to acknowledge our feelings. If we're worried about COVID and giving it to our family, then we need to acknowledge that. And then at that point, then we have to ask ourselves, are my thoughts logical? If I am taking all of the precautions that I should take, is it likely that I'm going to give this virus to my family member? Sometimes we have catastrophic thoughts where I've had friends tell me, well, I just have this vision of my husband who has asthma, just in a severe asthma attack, and I see him in my mind dying of COVID, and it's all my fault. So when we have those kind of thoughts, we can acknowledge them and that they're causing us anxiety, but then we need to challenge the thoughts and ask ourselves, is there any evidence that what I'm thinking is likely to happen? And if the answer is no, you think to yourself, well, I am taking all the correct precautions, I'm making sure that I'm doing things right, you can then practice cognitive reframing, in which instead of seeing that negative image of the husband dying or the children becoming ill, you want to imagine instead trying to visualize your family members being just fine and everybody being well, and practice this in sort of an exercise. And if you need help doing this, something like this, then psychologists are excellent at helping you learn how to practice cognitive reframing. It's a really powerful tool that can help you feel better about having these negative thoughts and stop those intrusive thinking patterns that can really be harmful to our wellness. Moving to another topic that's affecting physicians from COVID-19 are the financial concerns that doctors are experiencing. Doctors are already often having concerns about money, and now with COVID-19, 21% of physicians have been furloughed or experienced a pay cut, and 14% of physicians actually report that they're going to have to change practice settings because of COVID-19, with 18% making plans to retire, temporarily close their practices, or opt out of patient care. Microsimulation models have shown that primary care practices are estimated to lose a little over $67,000 this year per full-time physician based on losses from less patient volume. Just as I mentioned before, physicians before COVID-19 were already experiencing financial distress. This study from Medscape in 2016 asked physicians if they felt financial distress, and you can see here that across the board, every physician specialty has reports over 50% having financial distress, up to 78%. So how do we address some of those concerns that we have? Well, there are some resources, like the American Medical Association has a COVID-19 resource center that provides advice about how practices can try to restructure and take advantage of programs to help them financially. Definitely, we want to take the opportunity to utilize financial assistance programs that became available through the CARES Act, including the Paycheck Protection Program and small business loans. We may have to cut expenses. That can make you feel very guilty if you have to cut staffing, but if you have to cut them now and then later can bring them back, and it increases the chance of your practice surviving, then in the long run that may be the right decision. Certainly if you can cut advertising expenses or anything that's not necessary, and some doctors have reported that their malpractice was able to be decreased because they were not actually seeing patients, so check with your carrier about that. Physicians have turned to telehealth to help supplement some of their income, and that can be very helpful. And others have pivoted towards other types of practices, including doing locums work in areas that are still looking for physicians, or considering a model like direct care in which patients pay a monthly membership that's usually a low amount. Many direct care practices have reported being quite resilient to the fluctuations in patient volume because they get that monthly membership, so they're not seeing such a dramatic decrease in revenue from a lack of patient visits. The next issue that doctors have to address is how to cope with patients, not just on the front line, but dealing with patients sort of on an outpatient basis, or those that are not acutely ill, but that are extremely stressed and anxious. Of course, we know doctors on the front line, and also those of us just in a primary care setting, feel a sense of helplessness in treating patients with COVID because we really don't have great treatments or prevention right now. So it's very difficult to give patients what they're looking for, which is an answer or something that they can do proactively. It's also frustrating when we have patients that need routine care or have non-COVID related urgent issues, when those patients are sometimes not able to get the care that they need because of COVID being in the forefront. We have to remember that emotions are contagious, and as we're dealing with patients who are very anxious and fearful or even angry, that a lot of those emotions can rub off on us. So we have to be careful not to allow that to impact us too negatively. One thing that's important to examine and keep in mind is that as a society, we're really dealing with sort of a worldwide grief, if you will. And so if you look at the stages of grief, you can see the different types of responses to grief in different types of people. So the denial of that happens when we're grieving, we're seeing that in people who are following conspiracy theories or saying that COVID is a hoax. That may just be a form of denial for them not wanting to accept that this is real. Of course, anger, we're definitely seeing so much anger, and that is a part of grief. And we're seeing that in the anti-science sentiment, or people that are acting out in ways that are just really inappropriate, refusing to wear a mask when the store tells them to, threatening managers of stores or healthcare workers. Of course, bargaining is a factor in grief, And I think we see that in those who are requesting or advocating for non-proven treatments because they're just looking for something. And of course, depression is a stage of grief, and I think that that is happening among some members of the public, especially those that are choosing to extremely self-isolate, like refusing to even interact with close family members or friends in a safe way. And part of that may just be depression, and that is a response to grief. And then we need to remember that this societal grieving is not going away anytime soon. If you look at this graph that shows the phases of a disaster, you see that where we are in this is probably in this disillusionment phase. So we knew that COVID was probably coming as we saw it impact China and Italy. So we kind of had that pre-disaster warning. We had the impact, which may be somewhat we're going through still now, sort of a heroic phase, which we saw when the public was very proud of caregivers and a lot of congratulations and calling us heroes, what we call the honeymoon stage. And then now I believe it seems like we're kind of in this disillusionment pattern where the public is disillusioned, everyone's discontent, and that may be going on for quite some time. So what can we do to help manage our emotions? One thing that's really important is that we really need to regulate our exposure to COVID-related media. So we can't really avoid it at work, but we can take some steps to avoid it at home. It's important to really minimize our exposure to the media and make sure that we're using trusted sources as much as possible to get information. And that's not always easy. Usually I try to follow things that lean right and follow things that lean left and figure that the answer is probably somewhere in the middle. And I do try to rely heavily on the scientific experts, even though I acknowledge that they're not always going to get it right every time and that the guidelines and the science is going to change because that's what happens in science. One way to help with this is to give yourself limits on how much social media you engage in. I recently did this for myself for Facebook, and it's really helped me a lot to decrease some of my negative emotions about seeing constant bad news on my social media. So here's a way to do it. If you have a smartphone, especially this is for iPhone, but most smartphones have this. If you spend a lot of time on your phone on social media, you should go to your settings, go to screen time, and then select the app that you're looking for. So it has Facebook, it has Twitter, it has Instagram. Every app that you have on your phone allows you to set limits, and you can decide whether you want to choose to allow yourself 30. I've chosen 30 minutes, but you could do less or more. And then when you reach that time frame, you get a pop-up that tells you that you've hit your limit. You can choose to ignore that, or you can take the advice of your phone and you can do something different. Something else that can help is to disable the notifications on your phone or your iWatch or whatever you're using to get information, because if your phone is constantly buzzing and beeping at you, that can be really distracting and be negative. So one thing that's helpful, and I do this also for my computer, because if you're constantly getting emails and dinging and pop-ups, it's very distracting. So just go to your settings, and then there at notifications, you can choose to turn off notifications, and you can do that on your computer desktop as well. I think it's really important to avoid exposure to people that push your buttons and really negative interactions. I try to make sure that my social media feed includes people of all different perspectives, because I do fear cognitive bias or like an echo chamber where I'm just hearing opinions that I already believe. So I don't ban or avoid friendships with people that have different opinions than me. However, there will occasionally be a person or a group or posts that just really push buttons for me and really trigger me to feel negatively. So when I see something like that, what I do is I unfollow or snooze that person, or in some severe cases, I may even unfriend them. And these are all choices that you can make on social media that the person that you're unfollowing or snoozing does not even know that you're doing this. So this isn't anything that's going to come back to hurt you. It just allows you a break from that person. So I've included a screenshot here that shows you how to do something like this, but you can always Google it for whatever social media you're using, but most of these programs have a little area that you can click on. So here on Facebook, this person was posting something, so you go to the ellipsis up in the upper right hand corner of the comment, and when you click that, it gives you a drop down selection in which you can do something like here it says snooze Martin for 30 days. So temporarily you won't see his posts anymore. After 30 days they'll start popping up again. You can unfollow this person so that you don't see their feed anymore, but you're still friends with them and you could still talk with them and they can see what you're writing. And you can do the same thing for pages. Sometimes you get pop-ups from pages that you just don't want to see them. So you can snooze, unfollow, or unfriend at any time. And I do recommend taking advantage of this ability. Sometimes you just need to take a virtual timeout and just do what they call a digital detox or a digital Sabbath. Some people say on Saturday or Sunday that's their Facebook free day, or no social media whatsoever, no email. Ideally, even if you could get a week off and just really completely detox, that would be great. But any way that you can, at least just take a break from social media and from email and different stressful interactions would be really helpful for mental health. We also need to really spend some time focusing on our self-care. And most experts recommend that practicing meditation or any type of mindfulness is extremely beneficial to mental health. We need to take care of ourselves. We need to nurture relationships and social connections the best that we can, although we know that can be difficult in COVID. Help and support others, because when you help others, it makes you feel better about your own situation, and really take some time to do the activities that you enjoy doing. Self-care is, of course, making sure you're getting enough sleep, exercise, that you're eating right, and you're taking care of your medical needs. Doctors tend to be a little bit lax at doing these things sometimes because we are always trying to do more for other people. We don't always take the time to take care of ourselves. So we need to prioritize our self-care. The practice of mindfulness has been shown in many, many studies to help physicians and just the general public with their wellness. And mindfulness is really the act of just clearing your mind of all the clutter and just focusing on one thing at a time. And the simplest way to do this is just to do some breathing exercises where you just focus on your inspiration and your expiration. Mindfulness doesn't have to be prolonged meditation or yoga. It can be something really simple, just like really paying attention to the sensations that you feel when you're walking outside, the breeze on your face, the smell of the air, the flowers that you see, and really trying to enjoy the simple pleasures in life. It also is really helpful to just practice some deep conscious breathing, even if you just take 5 or 10 deep breaths a few times a day. That can be extremely beneficial. Another way to practice mindfulness is to focus on gratitude training, which is just to take a few minutes every day to think about the things in your life that you're grateful for and that you appreciate. And this has been shown in studies to improve our wellness. If you want to be more structured about practicing mindfulness, then I highly recommend looking for an app. For example, Headspace is offering free use of their app for all healthcare professionals through the end of the year. And this is an app that you put on your phone or your computer that kind of walks you through some guided meditations and some breathing exercises. There are lots of different mindfulness apps, including Calm and many others. So just check those out and give that a try and try to practice some mindfulness once or twice a day, and that really will improve your wellness. We also need to take the time not only to care for our physical needs, but also our emotional needs. And I'm going to go through some different ways that we can do this. First of all, we need to controlling our schedule and our time. And physicians often, because we're so busy and we're always wanting to help other people, we sometimes overwork ourselves and don't take care of our own emotional needs. I highly recommend that every physician consider taking a half day or a day off from work once a week so that you can take care of the things that you need to do for yourself. You should also schedule non-work activities and make them non-negotiable, like the time that you need to exercise or do something fun or have a date or just time off for yourself. It's really important that doctors learn to set boundaries, and this can be hard because we're often people pleasers. So whenever you're setting a boundary, then the steps to doing that is just to understand your motivation. So if someone asks you to do something, serve on a committee or participate in, give a talk, then and if your inclination was to say yes, then ask yourself, why am I saying yes to this? Or same thing if you wanted to say no, why am I saying no? What is it that drives me to feel inclined to do this or not do this? And if you realize that the activity you're being asked to engage in does not add value to your life, then it's perfectly fine to say no, and just realize that you don't have to explain in detail why you're saying no. Just saying no is a complete sentence, and it's okay. Now, you may not feel okay about it. You may feel guilty, you may feel bad. So you're going to probably need to practice saying no and feeling that it's going to be okay, that the person that you said no to is completely understands that you've got a lot going on. So as you practice saying no to things, then just visualize yourself calmly saying no and everything being okay. It's also so important that we set the boundary with work and not taking our work home. And that can be really difficult, especially when you're dealing with a difficult electronic health record and having to write notes at home. But you should really do everything that you can to set those boundaries so that you leave work at work and that home is time for you and your family. It's really critical that we share emotions, and we can do that through just simply journaling our feelings, talking to others. They call that peer group processing, which was studied for physician burnout. What the Mayo Clinic found was that when they allowed physicians time to get together with their colleagues just to have lunch or dinner, just an hour every week or two, those physicians reported lower amounts of burnout. They called that peer group processing, but I just call that getting together with your friends, and really it has been shown to be beneficial. Of course, in COVID, it's a lot harder to get together, so we can take advantage of virtual ways to get together with our friends or our colleagues through social media or Zoom videos, but we really need to share our emotions with our peers. And then, of course, getting actual professional therapy can be a really helpful way of processing our emotions. And especially that's using something called cognitive behavioral therapy, which essentially is just learning to identify your feelings and your thoughts, and then practicing cognitive reframing, in which you challenge your thoughts and your beliefs, and then you practice thinking in a different way that's more beneficial. And that's something that a psychologist or a physician coach can often be really helpful in teaching you the steps that you need so that you can start to take control of your thoughts and feelings. And by doing that, you actually can change your own behavior, and you can impact the behavior of those around you. To find a great psychologist or a physician coach, you can reach out to your county medical society. Many have physician wellness programs. Or you can always reach out to the physician support line, which is a new free and confidential line that is created by volunteer psychiatrists that want to help their colleagues. So this is the 888 number that you can call, or you can go to their website to learn more. Working with a psychologist can not only help us to deal with our own stress and improve our wellness, but we can also learn techniques from a psychiatrist or psychologist on how we can best help our patients manage their stress. We know that many physicians right now are feeling overwhelmed with phone calls and messages from patients who are anxious about COVID and want to know what they can do. When we're dealing with those patients, it can get frustrating. Sometimes we feel like we're repeating ourselves over and over again, or sometimes it seems as if patients aren't using great common sense. They're calling about minor symptoms or asking questions that you've already answered. So using psychology, we can learn that while we're interacting with those patients, we can practice our mindfulness so we don't become excessively frustrated or actually become angry with the patient. It's also helpful to create a tool like a macro or a template if you find yourself repeating the same things over and over again. For example, giving basic advice about managing upper respiratory symptoms at home, you can create something that you write up and then send to the patient in an email or a text, something like a little script, or you give it to an assistant to help you with, so that you're not constantly having to repeat the same things over and over again. It's also important that physicians learn how to not take their patients' emotions personally. We need to remind ourselves that patients are in the grieving process a lot of times, and they're maybe in the phase of anger or denial. And of course, they're misdirecting those feelings towards us, but that doesn't mean that they really have negative feelings towards us as physicians. It's more that they are just lashing out. So when we experience that type of emotion, we need to know some techniques to help move the patient through that stage of grief and help get them past that severe emotional distress that they're going through. It's impossible to reason with a person when they are in a very highly charged emotional state. Basically, they're in a fight or flight mode, and the more primitive part of their brain, the amygdala, is in control at that moment. Some people call that amygdala hijack, in which basically a person is locked into this emotional state, and they just absolutely cannot move their thinking into logical or higher order thinking. They cannot engage their frontal cortex. They're just stuck. So if you try to negotiate with a person in this stage, you're really not going to get far at all. Instead, there are other techniques that you can use to help move the patient through that emotional thinking and then be able to start problem solving. The way to do that is to practice a technique called emotional mirroring and validation. So the first thing you want to do is you want to identify the emotional state that you see the patient engaged in. So if a person seems very angry, they're yelling and they're being very loud, then you identify that emotional state and then you practice emotional mirroring just by stating how you think the person is feeling. So you can say to your patient, "It seems like you're very angry right now." And then you ask them if you're correct. Is that right? If the answer is yes, then you want to validate the emotion. And remember that that does not mean that you are agreeing with the emotion or in any way saying that the person is right to feel that way. You're simply letting the person know that you hear them and you understand what they're feeling. So if the person says, "Yeah, I'm angry," then you say, "Well, I can definitely understand why you would feel that way. I would be angry too if I was in this situation." If the answer is no, the person says, "No, I'm not angry. I'm just really worried about what's going on." Then you would restate the emotion that they've said and validate that emotion. So, "Oh, I see, you're feeling very worried. Well, I can understand why you would feel anxious. This is a really stressful situation." And then you want to continue just simply validating, mirroring and validating the person's emotion until you can tell that they're ready to move forward. And you can tell this because typically a person will give an audible exhale and then they will indicate that they are ready to move forward by inviting feedback or making it clear that they're ready to actually start working on a logical plan. But until they get to that moment, there's no reason to even try to problem solve. Just continue diffusing the situation. Now, saying that, I don't believe that any physician should take patient abuse or be put in danger or risk. So certainly if you see something like that, then you want to call for help. But for most people, if you practice this diffusing mechanism, then the patient actually will typically calm down and you'll be able to move forward. I think it's really important that all of us, we can't change everything that's going on, but when we act in a positive way and when we're role models, our patients see that and they do respond to that. So of course, we're all wearing our masks, and when we're out in public indoors, we're practicing the right techniques of physically distancing so that we're a good example to our patients. And then we also need to speak out and make sure that we are educating our patients on the facts of COVID to the best of our understanding and not be afraid to speak out, even though unfortunately COVID-19 has become very politically charged. It's still important that we try to take the politics out of it and just speak out about what we know about the science, what we understand about the virus, and what we think is the best way that patients and the public can act to help decrease the chance that they're going to get sick. You can do that just by talking to your patients, or you can take the step of attending public hearings like county commissioner hearings if they're going to be discussing COVID-19 topics like mask wearing. You can write an op-ed or even just post on your social media about what you know about the virus so that patients are getting information and the public is receiving messages from physicians, from scientists, and not just from anybody who posts their opinion. So it's really important that we counter some of the myths and misconceptions that are being spread, and that we make ourselves heard as scientific experts and authorities. But we also need to make sure that we take the time to take care of ourselves and to unplug. Once you go home, that should really be your sanctuary. Try really hard not to take your work home. Limit the amount of time that you're listening to the news media, and instead spend that time with your family and your pets at home. Make sure you exercise and do things that are fun. Even if it's something that's frivolous, like binge watching a little TV, I don't think we should make ourselves feel guilty about that. Sometimes we feel like we need to be so productive all the time, but we also need relaxation. I think it's really important to have some fun. So here's a couple of pictures of some of the hobbies that I picked up actually during the pandemic. I started taking some dancing classes. Here I am trying to do some samba, wearing my mask and taking precautions. And then I went to a painting class where the teacher helped me paint a painting of my dogs. And that was really fun and something I'd never done before. And just since I can't travel and take vacation like ordinarily I would do, which is my hobby, instead I have to find new hobbies and new recreational activities that I can do during COVID-19. So I encourage everyone to try to find something new, something fun, something that will engage your mind and not just be focused on all of the stressors in our lives, and know that we're going to get through this. Please reach out to me if you would like any additional information, and check out my books, the Physician Wellness book and also How to Be a Rockstar Doctor. Thank you so much.